Hello, we back on Konak Media TV, and we are continuing with the deworming column, the deworming portion of the antenatal card. Sister, at what time do we give the dewormers to the pregnant women?
Hello. Little miracles, big conversations. We are here yet again. Deworming starts exactly like how we give the SP.
Okay.
16 weeks. That's when you feel your baby's movement, or what we normally term quickening. Quickening because you just feel slight movement, something like that, at your abdominal side, and then you feel your baby's movement. Then we give the dewormer.
Okay. So please, pregnant women, be sure to take your dewormer home for consumption. We would now go to the follow-up visits. That is when you come subsequent visits. When we come subsequent visits, Sister Sylvia, what normally do you do for us when we come for our subsequent visits?
When we come for
our follow-up
visits, the date you came is recorded. We check your weights every time. If we have scheduled visits every month, you are supposed to. So every month when you come, we will check your weights, we will check your BP, we will do urine, protein, and sugar.
Okay.
Then the gestational age or weeks that you are at that moment is also recorded.
Okay.
Then we check your fundal height.
That's when you people use the seamstress tape measure, right?
To do that. We check the presentation of the fetus, whether the fetus is coming with the head, the bottom, leg, whatever that the baby is presenting with. Then the descent is how the head has come down.
That one,
whether it is high
above
or low
inside the pelvic bone.
Then the fetal heart rate of the baby, you check to hear if the baby is breathing. And that is when the midwife will put the fetoscope or the Doppler. You hear bo, 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 bo. You check the baby's heart. Then the iron supplements that you give, whether it is for 30 days, you give for 2 months, you continue treatment, it's also recorded there. It depends. Maybe the woman came a month, after a month she came, and you feel that within that time, the distance that she comes to you, you can include the iron for her. You give her 2 months, she will go and come. Continue treatment, maybe she has come within that time, she has not exhausted the medications that you've given her. So you write there to continue treatment. So you see sometimes we've written CT. You write 30, you write 60. Maximum is 30. So that is it. And sometimes we write there refer. Maybe you've seen something which you can't contain at your side. You refer to the doctor. That one too is also written there. Then the complaints that the woman has that very day that she came to you. Maybe she came complaining of thigh pain, waist pain, what? It also has its column. So you see complaints or remarks. If she is fine to you, right there, she's well or doing well. Then whoever saw her is very necessary. Maybe Nurse Gisam or Nurse Amwa saw the person. The person's name will come and then you sign. Then the next thing, which mostly sometimes they will go, if you don't even tell them or show them where it is in the book,
They won't find it.
Yeah, so the next visit that they are supposed to come back to you is also
Always.
recorded there, and you will tell her that it is written at this column. She should refer to it. Sometimes they forget. Sometimes they don't even know where it is written in the book for them to check up and then come on the exact date. So that is about the antenatal records. That's the follow-up visits, and it runs through now.
So you can come like 10 times throughout the pregnancy.
We have scheduled
but
visits.
If you don't have any complications, maybe
8 times at least.
But at least you should make 4+ visits.
4+ visits
during your 9-month journey. You should make at least 4+ visits.
At most 8.
And you should make a maximum of 8 months visits. Thank you. Let's just rush through the topics for counseling, because we would come back to take these topics one after the other. And when we go through the book, we would see that the topics are divided into trimesters. So during the first trimester, what exactly are we talking about, Sister Sylvia?
During the first trimester, basically is what we've been doing in our episodes. That's getting to know the antenatal book and then be conversant with the records in them. And then the purpose of having it. Then that's about thrice that you are supposed to, how to use the record book, the importance of it, the purpose of having it. I think we have discussed all those things previously. Then we will come to your dieting. The dieting runs through. Diet and nutrition doesn't stop. It runs through first trimester, second, and then third. Then malaria prevention comes there. Rest and exercise. We have personal hygiene. Mother to child transmission of HIV. Danger signs in pregnancy. Drugs and substance abuse. There may be additional topics that you feel would be necessary or will be important for the woman.
So you can maybe talk about maybe personal hygiene. Personal hygiene is even there.
It's there.
So looking at the woman, per your observations and your observations, you can now know which topic to give. Okay, so now the nutritional counseling, the topics spans from the first trimester, second trimester, and third trimester. For that, we will delve deep into it in our other episodes. So I wouldn't want us to go deep at that side. So that is all for filling our antenatal card. We are not yet done. We are left with the nutritional counseling and the 4-star diets, which we would visit in our later episodes. Thank you for having us in your homes. This is Konak Media TV on all social media platforms. Thank you.
Thank you. Bye-bye.